Uh, you asked me about the use of low-dose interferon in patients with early myelofibrosis, and I think that's a very exciting event. As you know, we published a pilot study. It was published in Blood in June 2011, and because of that, there's been considerable interest in using interferon in early-stage disease, because as readers of the MPN forum know, when the marrow becomes very fibrotic, all the JAK2 inhibitors really don't change the basic biology of the disease. That is to say, the spleen gets smaller, patients feel better because these JAK drugs interfere with cytokine release, and the patients eat better, gain weight, are more active, but the basic illness proceeds unabated. Accordingly, and if you use the analogy in clinical medicine, we don't wait for a diabetic to become comatose. We treat them with insulin. We don't treat a lady with a lump in her breast and observe her and say, well, wait until you get metastatic disease, or a man with prostate cancer. And similarly, to us, there's no rationale for letting a disease like myelofibrosis progress, as so many hematologists do. This, to me and to Dr. Hasselbach and Dr. Collagen, the notion of watching and waiting is something fraught with error and will predictably result in a patient progressing with their disease. So therefore, the use of interferon, because it affects these altered megakaryocytes and megakaryocytic release factors, platelet-derived growth factor, and other stem cells that are involved in the production of fibrosis in the marrow and enlargement of the spleen. The problem with this is that it takes a long time to get a good effect, stabilization of the illness or the reversion of the bone marrow, and thus it's very important that we use very low doses of interferon over a prolonged period. And the reason that interferon has not been successful in the past is because many hematologists have used high dose in advanced stage disease, where we know it's not effective, when the marrow is very sclerotic or fibrotic, and when patients have very large spleens. So that's too late. But very early in the illness, interferon can be helpful, as we have so indicated.